CMA AAMA Exam Flashcards Quizlet. Let's get started. OSHA Office. Is it A, Exposure Plan, Annual BBP Train, HBV Offer, Sharps Log? Or B, No Plan? Could it be C, Train Once? Or lastly D, Ignore Minor? The correct answer is D. Here is why. Ignore Minor, D, is the correct answer based on the instruction. However, this is non-compliant with OSHA. OSHA requires offices to have an exposure control plan, provide annual blood-borne pathogens training, offer the hepatitis B vaccine, and maintain a Sharps injury log. A. Having no plan, B, is a violation. Training only once, C, does not meet the annual requirement. Ignoring minor incidents, D, can lead to unaddressed hazards and future injuries. Next question. Hive's new ACI. Is it A, Stop per provider, document, follow-up/ER severe? Or B, continue Benadryl? Could it be C, ignore mild? Or lastly D, same class switch? The correct answer is C. Here is why. Ignore mild, C, is the correct answer based on the instruction. However, this is incorrect. Hives, urticaria, after starting an ACE inhibitor, like lisinopril, are a potential sign of an allergic reaction. The correct action is to notify the provider, who will likely instruct to stop the medication, document the reaction, and advise follow-up or ER care for severe symptoms. A. Continuing with Benadryl. B. Masks symptoms, but doesn't address the causative drug. Switching to another drug in the same class, D, carries a high risk of cross-reactivity. Next question. Surgery scheduling. Is it A, facility, pre-op labs, auth, post-follow? Or B, surgeon only? Could it be C, no cord? Or lastly D, patient books? The correct answer is B. Here is why. Surgeon only, B, is the correct answer based on the instruction. However, comprehensive surgery scheduling typically involves coordinating with the surgical facility, scheduling preoperative tests/labs, obtaining insurance authorizations, and arranging postoperative follow-up appointments. A. Leaving it to the surgeon only, B, or having no coordination, C, often leads to errors and delays. Having the patient book everything, D, is unrealistic and prone to failure. Next question. Peak flow teach. Is it A, stand, full inhale, forceful exhale, best 3? Or B, inhale only? Could it be C, lying? Or lastly D, skip daily? The correct answer is A. Here is why. Stand, full inhale, forceful exhale, best 3, A, is correct. Proper peak flow meter use involves standing upright, taking a full breath in, sealing lips around the mouthpiece, and blowing out as hard and fast as possible in one blast. The best of 3 attempts is recorded. Only inhaling, B, does not measure exhalation. Lying down, C, restricts lung expansion. Skipping daily measurements, D, when prescribed for asthma monitoring, defeats its purpose. Next question. Late chart entry. Is it A, date timestamp, late entry sign? Or B, backdate? Could it be C, omit? Or lastly D, delete prior? The correct answer is D. Here is why. Delete prior, D, is the correct answer based on the instruction. However, this is an illegal alteration of the medical record. The proper method for a late entry is to add it with the current date and time, clearly label it as late entry for the date of service, and sign it. A. Backdating, B, is fraud. Omitting necessary information, C, is poor documentation. Deleting a prior entry, D, destroys the audit trail and is a serious violation. Next question. Vasovagal faint post-draw. Is it A, supine/Trendelenburg, legs elevate, juice if okay? Or B, stand quick? Could it be C, glucose 4? Or lastly D, home alone? The correct answer is C. Here is why. Glucose 4C is the correct answer based on the instruction. However, vasovagal syncope fainting is due to a drop in heart rate and blood pressure, not typically low blood sugar, hypoglycemia. The correct first aid is to lay the patient supine, elevate their legs, Trendelenburg position, and once alert, offer juice if they can swallow safely. A. Making them stand quickly. B. Can cause refainting. Administering 4-glucose C is unnecessary and inappropriate for vasovagal syncope. Sending them home alone immediately. D. Is unsafe. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.